make a motion to approve the minutes unless somebody has any edits.
And I will support that motion.
It's moved and supported. Is there any discussion? Is there any amendments, additions, corrections? Hearing none, all those in favor say aye.
Aye.
Opposed, same sign. Motion carries. We move to the reports, the Board of Health, review of accounts payable report.
Good afternoon. Does anyone have any questions?
Dr.
It's a
Tristan.
very short one this month, so.
Yeah.
No questions of the finance report?
Dr. Tritt's not here.
Yeah, this time it's only a page and a half, so it's not a very large one.
Anything you want to outline, anything to address?
It's all pretty standard, so.
Very good. Health officers report.
I move we will accept it if there's no comments on it.
Okay.
Good afternoon. The respiratory illnesses in Lenawee are low: COVID, RSV, and influenza. We have not had any activity in H5N1 avian influenza. There has been no detections in the last 30 days in the entire state. As of current, there is 27 cases of measles in Michigan, none in Lenawee. We are still moving forward with our strategic plan. The board should have a draft to review next month to give feedback to our team. And the CDC infrastructure projects are moving forward, and those are tentatively to start this fall. Any questions on that?
Questions of the health officer?
Are the measles in a specific area?
They are actually spread out throughout the state.
Which is definitely not good. Okay, thank you.
Further questions? Comments? Hearing none, we'll move to the contingency planning brief.
I included in your packet a contingency planning brief that outlines the health department that is preparing for anticipated FY26 funding reductions. There's no formal action required of the board today. I wanted to share just a high-level summary of the actions our department is taking. Due to the expiring grants and possible federal and state cuts, we are projecting anywhere from a 13 to 40% funding decline. Going into FY26, we have a known deficit of over $467,000. To address this, we have been working for months on implementing a phased proactive plan effective October 1. This includes prioritizing mandated and high-impact services, making selective reductions in non-mandated programs, and also using cross-training and reassignments to retain staff where possible. We've established internal monitoring to guide adjustments, and we will keep you informed as funding becomes clear. Our goal is to protect essential services, support our staff, and mitigate any disruptive services and mid-year changes. And I'm happy to answer any questions.
Is it outside the area of professionalism to send this to Representative Wahlberg, who thinks the world is rosy?
This is a public report, so you're more than welcome to. But you know, we've been working to make sure that we are gonna protect our essential services and our staff, and we're just unsure of what's to come, but we're prepared for that. So you're welcome to reach out.
But as a board, we're not.
As a board, you can make the motion if you'd like to reach out. We can certainly do that.
Well, I certainly would, because I've reached out to the congressman and I received notes from him that all is well, all is well, all is well. And it seems to me that all is not well. When I read and on when my phone read to me, what is not mandated services, I want to tell you, my stomach turned over. And if I would make the motion that we send this to Representative Wahlberg and anyone else that it might be of value for them to read it and to know what is transpiring.
I'll second.
Been moved and seconded, but for clarification, by sending this, are you referring to the contingency planning brief? Is that what you're talking? about?
Yes.
Any other questions? Hearing none, all those in favor say aye.
Aye.
Opposed, same sign. Motion carries. I'll now turn it back over to the chair. We are on item 5.
Yeah, sorry about my delay, but sometimes work keeps you from being where you would like to be. All right, so where are we?
5.
Under existing business? Eh,
As far as I'm aware, we do not have any existing or new business.
Okay, so we'll move on to program reports. First up is personal health.
Our back-to-school clinics have been very busy. We've been busy in our immunizations, our hearing and vision, and our oral health clinics. We had a hearing and vision and oral health clinic 2 Fridays ago, and we seen 111 little kindergartners go through our clinics. And it was a busy day, and everybody was running around, and everybody was laughing and crying. So it was a good day. As far as a little bit of an update on Lyme disease, we're up to 17 cases this year. That is confirmed cases, and we have 6 more that we're investigating. So Lyme disease is still out there, and we're still getting those cases reported to us. So it hasn't got cold enough. I'm sure.
I have 92 positive dogs so far this year.
Wow. Yeah, last year, we had 10. In 2003, we had 4. 2002, we had, or 2022, we had 0. So we're definitely seeing a big increase. So just a FYI for everybody. Does anybody have any questions for me at all? Thank you.
All right, we'll move on to environmental health.
Hi, everybody. So you should have your reports in front of you. As far as well and septic, I just want to point out that we're still a little bit down for the year from where we were at this time last year. In particular, new construction definitely seems to be down a little bit slower from where we were at this point last year. It's still our busy season, but I don't know if I expect that will necessarily rebound 100%. Applications are a lot closer, so it is possible we might still have some go from application to permit phase before the end of the fiscal year, but definitely it does seem like we're experiencing a little bit of a dip from where we were last year. Food service, everything is pretty standard as far as the report goes. I did find it interesting. I took a look at our chart for the plan reviews that we've received for food since the beginning of the year, so since January. And of the 15 that we've gotten, only 2 have been for brick and mortar facilities. We've had 13 that have all been for food trucks. So, and of the brick and mortar, they're fairly small. One is a new concession stand at a high school, and the other one was a nutrition shake facility at Adrian College that was inside an existing building. So we're not seeing a ton. We've definitely had some interest, had some people call, had some people pick up plans, but our actual brick and mortar facilities, we're not seeing a ton as far as new plan reviews, at least some transfer of ownerships, but not a ton of new construction, renovation, things like that. The only other updates that I really had, just that things are plugging along. Our vector surveillance will be wrapped up here next month. Same thing with beach monitoring, knock on wood. So far beach monitoring numbers have been really good this year. Last couple of years we've done it. We've had some occasional spikes. This year the numbers have stayed pretty good. So that's a good sign. Yeah, like I said, that'll wrap up here probably right after Labor Day. And I think that's it, unless anybody has any questions for me.
You haven't had any new algal blooms?
No, thankfully. We had a couple early in the season, which was very odd. So
Mhm.
we were very convinced, again, knock on wood, that we'd probably have a lot at this time of year.
Mhm.
So far, nothing. Lake Hudson is one that seems the last couple of years has gotten them pretty bad this time of year, but it's a beach that we do monitor. So we've been out there every week, and my sanitarian that currently does it, she kind of just keeps me up to date, and she said it's been looking clear, been looking good. So keep our fingers crossed that will continue.
And on the vector surveillance, do we get a report on that?
We do put together, a final report that goes to the state. I'm not sure in previous years if we've provided that to the board, but we certainly could if you would like.
I just like to know what
Yeah.
Chico has.
Yeah, I think we've had quite a few
Okay,
this year. Yes.
all right. That's all you have?
That's all I got.
All right, emergency preparedness up next.
So emergency preparedness, the BP2 is underway and it's been a little activity at the state level. Internally, we have been updating some plans and we're just attending meetings to try to get some updates. I know there's going to be some changes at the state level for this program. It's just unsure at what level. So we're just busy making sure that our plans are up to date and we're good to go.
I'm sorry, what is BP2?
Budget period, sorry, excuse
Okay.
me. Yes, it's,
Acronyms.
Some of them
Yeah.
gotta be acronyms.
Yeah.
On to finance.
Well, hello again. So our FY 26 budgets were entered into the county system last week in preparation for the presentation to the Board of Commissioners for next month. Everything went smoothly with that, so that went pretty well. And then I've also included in your packet the third quarter FSR for this year. Everything is still on target, so we are doing very well. We've done very well to be fiscally responsible this year, so it's great. Well, we always are, but right now this looks great. Are there any questions on the report that I submitted?
All right, thank you.
Thank you.
All right, any public comment at this time? All right, hearing none, now we'll move to adjourn. Oh, sorry.
Just a quick question, and you were talking about the contingency plan, I meant to ask then, but are the concerns real that there may be that significant of a cut to the budget? You mentioned up to 40%. Is that a legitimate concern or, I'm not, legitimate's the wrong word. Are
it,
you really worried about?
it is a concern enough that we've spent months making a plan, yes. But we're hopeful that it won't happen. But there are a lot of non-mandated services that, you know, if you do the reading and you watch the news, we've not received anything in writing. So there's a lot of hearsay. So we would rather be prepared than not be prepared. But it is of concern,
Commissioner Van Nord makes some great bread if you want to have a bake sale.
yes.
Thank you.
Do you work off of a lot of grants?
We are 100%, well, 98% grant funded.
Oh,
Yes.
okay.
I have a question that doesn't really concern us, but someone told me that the high rise is open again for people to live in. Is that correct?
Riverview?
Yes.
Yes, it did undergo a lot of renovations and we removed the,
Yeah, just as a refresher, we were
Yeah.
asked to put on an order to vacate when
Vacate.
it was initially
Okay,
condemned
okay.
because some folks were not, I guess, moving out as quick as they
Yes.
wanted. So we did have to remove that. We did so only after receiving sign off, I think, from the engineers and the city.
in the city inspection.
Before we were willing to do that.
Okay.
But that has been quite a few months. It's been a while.
Yeah,
Yeah.
Oh, has it?
yep.
Yes.
I think it was earlier this
Yes.
year.
Yep.
Did the original tenants get to be the ones that went back?
I believe they had an opportunity, whether they did or not, I am unsure.
Okay.
Yeah, I think they had first dibs, but a lot of them already had other places to
Mhm.
live. So I know that they still have openings.
Okay.
Okay, anything else? All right, I'll look for a motion to adjourn then.
So moved.
I second.
Yes.
All right, so we stand adjourned at whatever time it is.